The time's now 9:16. Even if you're not fond of taking pills, it is important to pay attention to your doctor's treatment plan and take medications on time and exactly as prescribed. Your health could depend on it. Dr. Brent Wallis joins us from People's Health to explain the importance. So, Dr. Wallis, what happens if people are not taking these medications as prescribed?
Sure. So if you don't take your medicines as prescribed, nothing good happens at all. It could actually make your disease worse. You could get even sicker, or unfortunately, you could even end up in the hospital. So that's why it's really important to always talk to your physician if there's a reason that you can't take the medicines as we've prescribed them.
And Dr. Wallis, I know another issue that physicians run into is people say, oh, I feel fine, I don't need to take this medicine anymore. But that's a problem too. Why is that?
Yeah, we hear that quite often, and actually what I usually say is that the reason you feel good is because you're taking the medicines. So you don't want to stop them because then your disease could actually get worse. If you're having any problem with your medications, that's where you really want to have a discussion with us so we can figure out what we need to do to make you feel better.
And talking about problems, side effects could be a problem for some people, and they may think, I don't like how this makes me feel. I'm stopping this medication altogether. Why should that not be people's choice? Why should they go the route instead of again, having a conversation with their doctor?
Yeah, definitely. Every medicine can have side effects, some worse than others. And the good news is that actually we have a lot of different medications that we can use for the same problems. And so if you're having difficulties with one medication, you can talk with us and we probably can find something else that will react better with your individual system. So again, always talk to your doctor about that.
And also, Dr. Wallis, I know people might, be on one drug in particular, and perhaps the cost of it goes up before their next fill comes up, and that might be a reason people decide, I'm not taking this medicine anymore. Why should people, again, go to their doctor instead of opting to just stop taking the medication that, again, is helping them?
Yeah, drug costs continue to rise, and that's a real problem. And we don't want people to have to make the choice of purchasing their medication or purchasing food, for example. So you can talk to your doctor. There's a lot of generic medication options that work just as well as the brand name medications. We can help you select the right one that fits more into your budget. If you have Medicare, there's also a program called Medicare's Extra Help Program that you can actually talk to your counsel on aging about. Sometimes we can actually get discounts on medications or lower copays. So again, something you definitely want to mention to us if you're having trouble paying for your medications.
So Dr. Wallis, let's say everybody is following their medication, the regimen, or the instructions on how to take it. They're not concerned about the payment. They're not worried about these side effects anymore. What is your advice to make sure people stay on target, take those medications as they are prescribed, and again, ultimately make themselves feel better?
Yeah, I think one of the best things you can do actually is get a pill box. Most doctors or health plans will give you one for free, and you can actually lay out the pills that you need to take on a weekly basis, and that way you know if you've ever missed anything. The other important thing would be to stick with a routine. So if you know every morning you brush your teeth, put your pill bottle next to your toothpaste so that you can remember to take it every morning and you don't miss doses, because that can be really bad as well.
Dr. Wallis, just some really good tips. The biggest thing, though, is follow those instructions and keep an open line of communication between you and your doctor. As always, we appreciate your time.
Thank you very much.